As we look from the side, we can see how the matrix band now almost hugs into the tooth. And so for many cases, we can just get a better form to our contact by using these rings that have these prongs that go over top of the wedge instead of the ones that push the wedge into the tooth. Hello Dental Online trainers, I'm Dr. Dennis Hartlieb and welcome to our clinical mini tip. Contour matrix bands and contact matrix band rings. In our little mini course today, I'm going to be showing you a different variety of matrix bands that I use in my practice, and I'm going to describe to you how and where and why I use these different matrix bands. Because every tooth contact is a little bit different from a different tooth contact, and I want to explain how I'm using these matrix bands in different situations. Also, we're going to talk about our contact rings. And if you've taken the Class 2 course, you know that I talk that very often I don't use contact rings a lot in my practice. But when I do use the rings, I want to talk about when I use certain different types of rings. And I'll show that also with our little hands-on. All right, so today I have a little typodont model, much as like what we used when we were in dental school. So I'm going to pull out my microscope and I want to look at this Class 2 preparation that I have. First, we're going to talk about some matrix band options. Alright, so you can see that I have this Class 2 preparation. It's a mesial-occlusal preparation on the lower right molar. Now the first thing that I'm going to look at, what I want you to look at when you're practicing, is what is the contour of the proximal contact of the tooth next to the tooth you're restoring. So in this case I'm looking at the bicuspid and I see that the contour is very flat. And if you consider the type of matrix bands that we have, if you use a really highly contoured matrix band, it's not going to go into the contact without binding on that neighboring contact. So my first consideration when I'm looking at this contact is that I have a very flat contour to the neighboring tooth, so I'm going to have to use a band that has a fairly flat contour to it. The second thing I want to look at is the height of the tooth I'm preparing. Is it a short tooth or is it a longer tooth? Because that's going to be the second consideration. Do I want to use a shorter matrix band or a longer matrix band? Because my goal with my matrix band is for it to be just subgingival, so I can seal the cervical margin, and it should only be about 1 millimeter above the occlusal margin of the neighboring tooth. Now for those of you who have taken my Class 2 course, you know that I really like the matrix bands from Hartlieb Neos. These are these clear contoured sectional matrix bands. Now this is their, what they call purple, but it's a dark blue band. And if I go ahead and slide this matrix band into the proximal, one of the challenges I'm going to have is because this band is really highly contoured, it's going to bind a little bit. It's going to be difficult for it to seat because of how highly contoured this band is relative to the neighboring tooth. So one of the challenges with these, when we're using these typodonts, is to get the matrix band to slide underneath this rubber gum tissue. And again, what I'm looking for is to get this matrix band so it's about 1 millimeter above the proximal contact of the tooth. And then when I'm looking at the matrix band, because the neighboring tooth has a very flat contact or contour, and my band is highly contoured, there's almost like a little bend into the matrix band where it's not able to flow freely. So on a tooth like this, instead of using my most highly contoured band, I'm probably going to want to use a band that's a little bit flatter. So if you look from the proximal, you'll see that I have a contact, but it has this sort of indentation to the matrix band. So that's telling me this matrix band is just too highly contoured for this proximal surface. So instead of using this band, I'm going to pull out another clear matrix band from Hartlieb that is a little less contour to it, a little flatter. Hartlieb refers to these bands as their blue bands, and these are sort of a lighter colored blue. And when I place in my lighter colored blue band, I'm going to get a much better contact because I've selected a band that has a flatter profile that is more similar to the tooth that we're trying to match. And again, I look to see that I'm about 1 millimeter above the occlusal margin of the neighboring tooth. And now when I look at the tooth, I have a much better contour to it and less of a ripple or an indentation into the matrix band. So as I said, what I really like about these clear matrix bands is that they don't wrinkle, they don't distort. So as I'm placing them in between the teeth and working with them, I don't get any wrinkles into the matrix bands, which I really, really love. Now the other option for our matrix bands are metal matrix bands. There's so many different metal matrix bands to choose from. One of the popular ones is from Garrison Dental. It's a really nice band. These are sort of kidney shaped. I like using these metal matrix bands with the convex surface towards the cervical and the concave surface towards the occlusal. Now one of the challenges with any of these metal matrix bands is that as we place them, they can get this distortion or wrinkles into the matrix band as we try to slide them in. So we have to hold them really gently, because if we get any wrinkles or any creases in the metal, it's going to stay there, and then we're going to have a restoration that mimics that. Now, same thing with these metal bands. We want to go ahead and get the metal band to go underneath the gum tissue with these rubber models. So again, one of the challenges with the metal matrix bands is that when you get them in, very often you can get these little wrinkles. So the challenge is trying to find the matrix band that has the ideal contour so that it will give us a nice proximal contact in the middle third or the upper half of the middle third of the proximal contact. This really illustrates really nicely how we want to be able to define this occlusal embrasure. So you can see how the contour, the proximal wall will contour back in towards the tooth, so you don't have a flat contact, but it contours back to have an appropriate occlusal embrasure. Okay, to overcome some of the challenges of the metal matrix bands wrinkling or deforming as we're using them, some of the companies have come up with almost like little handles for their matrix bands. So this is from Trident, and you can see that they have a little holder area that you can literally just sort of bend. So you can use this for as you're placing your matrix band. And you can see the holes on either side, which are useful for you to be able to grab hold of the matrix after you've done your composite. You also see that this matrix band has this Teflon coating, which is especially helpful when you're using self-etch adhesives. With the self-etch adhesives, sometimes those will stick to the stainless steel bands. So these coatings can be very helpful to keep the adhesives from bonding onto your matrix band. Now again, the same thing, we want to slide this matrix band so it just gently seats underneath the gum tissue. The advantage of these type of bands is that you do have these little extensions that you can use to place the matrix bands. And again, with these little holes here, you can get an instrument there to help pull out the matrix band. That gives you a sort of sample of different matrix bands that I use in the practice, depending on how deep the preparation is and how much contour. And that's really the two big issues for me. Now, let's talk about our contact rings. I'm going to place in a wedge just to support this matrix band. Now, one of the challenges that we spoke about during our Class 2 course is very often when you use these wedges, the wedges can actually push the matrix band into the tooth preparation, or they can deform the matrix band and almost push your contact. Instead of being in the middle third of the tooth, it's actually pushing it up towards the occlusal margin. So when we see that in practice, what do we typically do is we'll go in with an instrument and we'll burnish the contact to get the contact more into the middle third of the tooth. But when we do that, we tend to get these wrinkles or these deformations in the matrix band that's going to be happening in our composites. So when we look at the two options for the rings, either sort of these point rings, the question becomes, do you use these to go outside of your wedge and use the wedge to curve into the surface of the tooth? Do you go above, or do you go in between the matrix band and the wedge? So my preference has always been to use the wedge to curve into the contour of the tooth. I find that I get the best seal by doing that. But this is exactly one of the reasons why I am often challenged to use these type of rings, because you can see immediately how the matrix band deformed as the ring is connected onto the tooth. So in our Class 2 course, we talk about pre-wedging techniques, because very often I don't have to use these type of contact rings because of that very issue, which I know many of you have also experienced. Now, the other type of ring that we can use is these rings that go over top of the wedge. And these rings, this particular ring is from Reinvent. These are the Nitin ring. These type of rings that have these prongs that go around the wedge, they can allow us to help create a better contour to the matrix band and also help seal that matrix band to the proximal tooth. As we look from the side, we can see how the matrix band now almost hugs into the tooth. And so for many cases, we can just get a better form to our contact by using these rings that have these prongs that go over top of the wedge instead of the ones that push the wedge into the tooth. So a lot of it is dependent on the size of the proximal box that I'm restoring and the amount of wall that is missing from that proximal box. One last thing, if you're not using a rubber dam, I would highly recommend that if you're going to be using these type of contact rings, that you actually ligate the rings with floss. I was contacted to be an expert witness on a case where a dentist was using these contact rings. The ring slipped off while he was working, and because the ring was not ligated, the patient swallowed the ring, actually aspirated the ring. And so when we use these rings in the mouth, if I'm not using a rubber dam, then I will use some sort of floss to make sure that the ring, if it should pop off, I have it so that I can grab it with this floss ligature. Okay, dental online trainers, I hope that you found this mini tip course helpful for you as you're selecting matrix bands for your posterior composites. And also when you're considering if you're going to use a contact ring or not, which type of ring you should use and where you should be using them. We look forward to seeing you in other courses with dental online training. So good dentistry to you, and we look forward to seeing you soon.